12-lead acquisition. In patients that are actively being treated for real or suspected cardiac ischemia, a 12-lead ECG can be acquired to determine if the patient is STEMI positive and falls in or out of STEMI bypass guideline criteria. The accuracy of the ECG tracing is affected by many factors, including the quality of contact between the monitoring electrodes and the skin surface. Similar to applying defibrillation pads, prepare the skin surface of the chest, if necessary by thinning chest hair and wiping away sweat to ensure adhesion of the electrodes. In most circumstances, you have already initiated continuous cardiac monitoring, and the 4 limb leads will be in place and the patient will be on your stretcher. If not, apply these leads first and initiate continuous cardiac monitoring. Placement of these electrodes on the limbs improves accuracy of the 12-lead acquisition. From these limb lead electrodes, leads 1, 2, and 3, AVL, AVF, and AVR can be displayed and lead 2 rhythm interpretation assessed. Following the limb leads, the 6 precordial leads are applied to the chest. Landmarking for each begins with the V1 lead, which is applied at the 4th intercostal space immediately to the right of the sternum. Follow this by the V2 lead at the same level, 4th intercostal space, immediately to the left of the sternum. The V4 lead is typically placed next, at the 5th intercostal space, on the midclavicular line on the left side. V3 is placed equidistant between V2 and V4. The V5 lead is placed at the anterior axillary line while V6 is placed along the mid-axillary line, more lateral to the V5 lead. Leads V4 through V6 should form a straight line from the 5th intercostal space to the mid-axillary line. Connect the precordial leads to the limb leads at the connector point. To acquire a 12 lead, depress the 12 lead button on the left side of the monitor display. You'll be required to enter the age and gender of the patient, which is used by the analytical software along with the electrical input from the leads to determine the presence or absence of STEMI. Turning the large dial on the bottom right, set the age and depress the center of the dial to confirm. Then enter the gender in the same manner. Prior to acquiring 12-lead analysis, ensure that the leads are all making good contact by visually inspecting each lead and looking on the display for error messages. Also, ensure that the patient is sitting still in a semi-sitting position. Press the 12-lead button again to acquire the 12-lead. The recorder will begin printing automatically once the 12-lead analysis is complete. Remember to record the results on your ACR and follow the documentation as per the STEMI bypass guidelines. In the pre-hospital environment, 12-lead acquisition is a very specific diagnostic tool used to determine the presence or absence of ST elevation MI. The absence of ST elevation does not equate to the absence of a cardiac event.